Thank you, Mr. Chairman.
Senator Moody.
Thank you, Mr. Chairman, for holding this hearing, and for our witnesses for being here today. Some of you I've met with personally, so appreciate your time on such an important topic. This country has blessed the world with numerous treatments and cures for all kinds of diseases in the 50 years since biotech became a reality. American biotech is strong and growing in Florida. I am one of the newest U.S. Senator from Florida. I am told it is home now to nearly 3,000 biotech, pharmaceutical, and medical development enterprises. We are home to 27 bio members. Immune Bio, based in Boca Raton, is a new biotech focused on developing 2 new drugs, one novel therapy to treat Alzheimer's and another to treat an ultra-rare pediatric skin inflammation disease. But like so many other companies, it chose to plant roots in this country because we have free markets, deep pools of capital, and a highly talented workforce. I believe Florida is only becoming more blessed with more talent in this area. So we've seen progress from startups having multiple drugs heading into phase 3 trials, and that demonstrates how small science-driven companies can drive significant progress for patients with nothing else that can help. In September, the Miami Times reported that Florida is the first in the nation for investment in clinical trials, now ahead of California and Texas. So that to say, biotech is a burgeoning sector of my state's economy, and I agree with the chairman that Congress should work to unleash the power of American life sciences. So thankfully, we're seeing this president and other initiatives that have invested over $425 billion in investments for R&D, manufacturing, and jobs. I think that is incredible, and I expect great things throughout this administration. Mr. Crowley, I'll start with you. I was touched by your story. It is truly amazing, and I think it's emblematic of what we can do when Americans have a personal cause and the resources to do something about it, and the policy that would support successful outcomes. And that's so important, and why this committee is addressing this important topic. I've heard from so many of my constituents that a faster, clearer guidance from FDA, particularly on rare neurological diseases, would be greatly beneficial. They've told me that additional support for accelerated approval pathways could contribute to huge breakthroughs for patients. McCary recently announced the FDA's intent to establish a new conditional approval pathway for drugs, which could further empower biotech to bring a greater diversity of cures to patients suffering with rare disease. How do you believe, well, what is your opinion on that announcement, and how do you believe that we as Congress can make constructive changes at FDA to empower biotech and bring more breakthrough therapies to market?
Great. Senator Moody, thank you for your question, and thank you again for everything in the state of Florida. When our children were originally diagnosed, one of the first centers we went to all the way in Florida from where we lived in New Jersey was Shands Medical Center. So you've got the right ecosystem, the right environment. Years ago,
Well, it's the University of Florida.
The University of Florida, yes.
Go Gators.
Go Gators.
My school, but I'm just saying that.
You know, for Senator, you're absolutely right. When we got into this world,
The senator is out of order.
He always does that to me.
I'll throw in a go Irish. So, Senator, you're absolutely right. When I came into this world, all we focused on was science, medicine, technology, raising capital. Now in this world of rare diseases, we've never had more technologies, more opportunities where doctors don't have to tell families, parents, what they told us years ago, that I'm sorry, there's nothing we can do. There are a range of options. Most of our challenges now are man-made, including regulatory. And we need to modernize. We need to strengthen the FDA. We don't want lower standards. We don't want them to approve everything. There are advanced regulatory tool sets, biomarkers, surrogate endpoints, adaptive clinical studies, Bayesian statistics. What we need is an FDA that's modernized, strengthened, and that uses the entire tool set and looks at every disease and every proposed molecule through a risk-benefit assessment. Nothing is without risk, but take a look at each of these diseases, particularly in the rare diseases. So we're seeing very positive moves toward that, the creation of the Rare Disease Innovation Hub, other moves that I think we'll continue to see from the commissioner. So we've provided some ideas, and we'll continue to work with the FDA on that, but it's incredibly important so that we get as many therapies to absolutely everybody in need as quickly as possible.
Thank you, Mr. Chairman.